Governor Bevin is with us now. Good morning to you.
Good morning to you as well.
All right, so after the governor, where are you on the pill? Or after the visit from the vice president, my apologies. Go ahead.
Yeah, I mean, no, absolutely. You and I both have that issue. I'm delighted that he is now the vice president. I'll tell you this, at the same place that I was before, and that is this. That initial comment was taken very much out of context. What I said is that is the beauty of the democratic process. Of course there are differences as to what the exact details should look like. There is 100% agreement, however, among Republicans that we need to repeal Obamacare. 100% agreement. 100%. So unanimity. To that end, the key is where are the differences and how are we going to accomplish those, reconciling those parts between now and when this is done. The reconciliation process, the companion legislation, and then the administrative regulations and procedures. Those are the three parts to getting to the end solution. I think we're well on track.
But, Governor, both you and Senator Paul were aware that this was a three-pronged approach. And when you say that, quote, things need to be a lot stronger, what do you think needs to be, as you characterize it, a lot stronger?
Sure. First of all, we've got to make sure that we repeal and replace at the same time because states need flexibility as it relates to handling the Medicaid portion. In Kentucky alone, nearly 1/3 of Kentuckians are on Medicaid, so it's a significant impact on our budget and our population. We want, at the end of the day, to not compromise health care outcomes. Coverage is not the point. Simply giving people a plastic card is not the point. The point is to create a healthier population and better health outcomes. That must be the focus. So what would I like to see? I'd like to see more flexibility at the state level. I'd love to see governors being given more autonomy over what they do regulatorily and as it relates to what percentages of the federal poverty level they might be able to go up to while having either expanded or unexpanded Medicaid. These types of things have got to be done. I'd like to see also this requirement to have compliance not be given to 50 different states. To me, that's irresponsible. The idea that every state would develop their own IT module funded by the federal dollar is silly. Come up with a single set at the federal level and allow states to use those tools, a single set of tools that they could use. Simple things like this. We're not far apart. It does need to go. Obamacare is a failure. Everyone has agreed on that, including in Kentucky, where I can assure you, with absolute no doubt, that this is not working in Kentucky. It is an abject failure.
All right, Governor. About the timing of this. Senator Cotton this week said that this is all moving a little too quickly. Let's remind people of the timeline of the passage of Obamacare. Plan introduced in July of 2009. CBO released its score 3 months later in October. We're less than a week into this, and we're expecting it to be released tomorrow. House approved it in November. Senate in December, and the president signed it in March of 2010. Do you agree with Senator Cotton that this is moving too quickly?
Number one, I appreciate the sense of urgency. It's not as if we didn't know this wasn't coming. I mean, the reality is we've been talking about this for years and years and years. There have been proposals and conversations going on for years and years. Now those conversations are being reconciled and brought to the forefront. So I'm not concerned that this is going too quickly. If you remember, when it was done under the timeline you just described, nobody saw it. Nobody saw it. Nancy Pelosi famously said we needed to pass it. We needed to pass it to see what was in it.
Forgive me, Governor, but if Republicans knew that this was coming, why is it taking such a heavy lift to get Republicans on board with the same proposal?
Because this is a transparent process, unlike the last time when it was done in a back room and people thought they needed to pass it to see what was in it. This is transparent, and when you have 435 representatives in the House and 100 senators on the other side and 300 and some odd million American people all being able to weigh in and give their 2 cents worth, of course there's going to be differences of agreement. But again, on the Republican side, there's absolute agreement that Obamacare is a failure and it needs to be repealed and it needs to be replaced. It needs to be gone.
But what next is the question that needs to be answered. I want you to respond to what a fellow governor out of Connecticut, Daniel Malloy, said, what he said to our Ana Cabrera last night here on CNN. Watch.
It will take insurance away from millions. people. It will gut Medicaid. It will cause people to lose their lives. It will cause hospitals to close. It will cause other clinics to close. You know, I'm in my 60s. If I was to go to the marketplace under this plan, I would have to pay probably about $8,000 more for my coverage. That's what they're doing, folks. Everyone wake up and understand that this is repeal and replace with the emphasis on repeal and really not replace. What they're going to do is make you sicker.
In addition to what we heard from the governor, the AMA, the American Medical Association, AARP, several other organizations have come out against this bill. You say to them what?
Couple of things. Number one, stop the drama, stop the misrepresentation of reality. This argument that suddenly, if you were to replace this, the costs are going to go up. What, like they haven't been of late? I mean, let's think about this. We were lied to and told that costs were going to go down. People could keep their health care providers and their doctors. The exact opposite has happened. And now to pretend if we were to go back to some variation of what we had or even something better, that costs are going to go up, that's the reason, that's nonsense. Number two, the idea that people are going to die in the streets, and although I don't think he used in the streets, that's essentially what he's implying, is that suddenly there's going to be, you know, healthcare mayhem in America. Nonsense. Only half the counties in Kentucky even have a single provider at this point. And we have huge players like Humana and Aetna and others that are frankly leaving the exchanges, United and others who have done so. The fact is the system is failing. And this idea that somehow that keeping this broken system is the only solution is absolutely not correct.
All right, Governor Matt Bevin of Kentucky, thanks for being with us on New Day.